I'm Jan Walker, VP Strategy, Innovation, and Chief Information Officer at West Park Healthcare Centre. And I really appreciated the conference these last couple of days because it brought together disparate groups, clinicians, hospitals, vendors together to talk about issues that will support the Internet of Things in healthcare going forward. For example, interoperability and integration.
I've been to an IoT conference before, but they're getting better and better. And this particular one, I have so many take-home points to bring back to our team at Appletree and at Canadian Health Systems. This was 2 days of intensive learning, and I really enjoyed the conference.
My name is Jeffrey Flamion. I'm a pharmacist from Children's Hospital in Minnesota, and I came to the conference to speak about our interoperability with smart pumps and our electronic medical record. It was nice to be able to bring this information here since they're working on implementing more HIT systems and looking at interoperability. The conference has been great. I've learned some things here that I can hopefully take down to the U.S. market, and hopefully I could impart to them some information that will be helpful for the future in this market also.
So I'm Asim Masood. I'm Regional CMIO in our LIN. I'm also an emerge doctor at William Ulster Health System. I was delighted to come to this conference, a really interesting event. I really enjoyed the cross-provincial conversation, look at other people's journey and understand kind of where they are, see some people that are further ahead, and Ontario, for example, has to catch up. So it was a really great learning experience for me. A lot of great takeaways and great accomplishments from my colleagues. So that's the part I really enjoyed, and listening to different people in different states of their IT journey. So those are the parts that resonate with me. And I also really liked the clinical examples that people brought forward. There was a good number of clinicians in the room that kind of aided and strengthened the discussion and really got deep into the weeds and sometimes around clinical adoption. So I really enjoyed that part. So I was happy to be invited and love to attend again. Thanks.
So hi, my name is Frank Pelty. I'm the Senior Manager for Information Technology and Connectivity for Becton Dickinson in Canada. IoT healthcare, for my first time in Toronto last year, obviously, I think it was worth a repeat performance here out west to be, have a picture that's going to be more centered around BC, Alberta, and the western provinces, and the work they're doing in regards to, driving data, analyzing that data and making sure that it becomes a valuable tool at the point of care, so it really impacts patients. And I think you hear stories from Alberta Health Services, from the various health authorities in BC, and people coming from outside, from the U.S., Stanford, Children's Minnesota coming in and telling the challenges, the benefits that they got from the solutions, and really basically being a guiding light for some of the efforts that we're driving here, but also highlighting some of the great work that the Canadian landscape is doing. So I think, again, IoT healthcare, the conferences are doing a great job to bring these people together, really, creating challenging discussions. You see some people are very passionate on both sides, especially in regards to patient privacy, some of the use, secondary use and primary use of that data, but enlightening discussions that we definitely need to have because these will never go away unless we all agree. So once again, I think it's a very valuable conference. Looking forward to the next one.
Hi, my name is Dan Levitt. I'm the Executive Director at Tabor Village and an Adjunct Professor of Gerontology from Simon Fraser University. I was one of the speakers this afternoon at the IoT Big Data Conference, and very honored to be part of this. This is a great gathering of senior executives, of people in the industry who are responsible for data collection, for IT, for health records, and these are the people who come to this conference, are really the people who are making decisions around the future of our industry and how we can improve the use of technology, making our lives better. So this is just a great opportunity to get together, share ideas, and to meet other colleagues and learn from each other, and probably have the leading experts in our sectors in healthcare talk about IT and information exchange, especially around big data.
My name is Anjum Chagpar. I'm the Managing Director of Healthcare Human Factors, and I'm here today because I think the potential for the Internet of Things and big data in healthcare is it's transformational. Obviously, it's massive, and the ideas here today are really, crystallizing the potential, but also the challenges. So I think there are important conversations to have about, what the future can be, but also how to get there. Lessons about how to get there.
Hi, my name is Marlon Onid. I'm the Chief Operating Officer from Portal 724. We're an exhibitor and a sponsor of the IoT events that are happening in Toronto here. IoT conference is a wonderful conference. We've been at it 2 years in a row. We welcome the opportunity to participate because some of the people that we are meeting here at this conference are exactly whom we should be meeting with. We're finding that all levels of management and practitioners are gathered here. So we've been able to see some vice presidents and some CEOs of hospitals and healthcare institutions and medical centers in this place, as well as some government representatives, as well as have met some physicians and some clinicians and nurses and people that are engaged and are champions in their own domain, in their healthcare authorities and in their healthcare institutions. We offer remote patient monitoring, so the idea of being part of the IoT events conference is very important to us. People that are here are looking for the transformation into the digitization of healthcare. And we are a company that provides remote patient monitoring and personal health records platforms, and obviously we're on the forefront of digitization of healthcare. So therefore the crowd that is coming here and the conference is very specific for us. So we're able to go one-on-one with people, and that's a wonderful opportunity. We've been to Arab Health, we're going to eHealth, we've been in every other health conference. The specificity of the people and the subjects and the transformation aspirations they have is more important to us than the bigger conferences where it's a shotgun approach. This is laser guided approach. This is talking to the right person at the right institution, dealing with the right chronic illness or right project, and we're able to talk one-on-one and lots of time on our hands to have these wonderful conversations with them. We're walking out of this conference with at least 20 to 30 opportunities that have opened for us as a result of being here. So are we coming back? Not only are we coming back, we asked the organizers to set us up for the next 2 to 5 years going forward with IoT events such as these. So we're looking forward to working with the team, and we expect far more from one conference to the other. This conference this year is wonderful. We got a lot more out of it than the last year. We expect to be in Vancouver. We expect Vancouver to be bigger than this. And next year, IoT, third year in a row, will be an even bigger conference, and we're excited about that. Thank you very much.